Hello, everybody. So, today we'll be grabbing a hold of mental health and we'll be going over the struggles of schools supporting mental health. And in this, we'll be talking about ACE scores and trauma enforced learning. Open discussion. So, in your own words, what is an ACE score? And what knowledge do you already hold about ACE scores or an ACE test? So, just take the time to go over this and think about what you don't know, and what you would like to know. What is exactly an ACE score? ACE stands for Adverse Childhood Experiences, meaning stressful situations or trauma that a child can experience that affects their ability to respond to stress. A high prevalence of stressful situations can and will affect a child's ability to learn and develop in a timely manner. The ACE test allows for a form of categorizing a child's experiences and concluding possible effects the child might experience due to their past traumas.
ACE scores and who has them. Everyone has an ACE score. All students have a certain ACE score, and it's just personal to their own lives. A higher ACE score means that a student has gone through more trauma and abuse in their lives, while a lower ACE score means that students have experienced less trauma and abuse throughout their lives so far, but they still haven't experienced it to an extent. Course learning standards. In this lesson plan, the two course learning standards that will be covered are 1. Identify the roles that federal and state and local governments play in consideration of equal education provisions, comparing the types of school, public, charter, private, virtual, and the ways that they are organized and supported. The second learning standard that is covered is analyze the influence of shifting demographics on the school districts and describe the way in which schools respond to changing educational needs of students in the United States.
Here are some of our Strand learning objectives. By the end of this presentation, students will be able to express how they feel on their stance on mental health. They will be able to identify and describe what the ACE test is, and they will be able to identify and describe the components of each ACE score.
Many teachers and students want to know, what is an ACE score? Your ACE score is how many points you tally up over different types of questions. There are 3 main ACE categories which your tally could be pertaining to. The tallies could be pertaining to any of the 3 categories here: abuse, neglect, or household dysfunction. Under abuse, we have things such as physical abuse, emotional abuse, and sexual abuse. Under neglect, we have things such as physical and emotional abuse. And under household dysfunction, we have things such as mental illness, an incarcerated relative, a mother that was treated violently, substance abuse, or a divorce within the household.
What effects do ACE scores have on people? ACE scores are a pretty serious thing, and they can affect people in a ton of different ways, some of which are good or bad. Some of the side effects are listed in the next slide. This infographic shows us some of the different ways that people are affected by their ACE scores. It's broken up into the behavioral and physical/mental health side effects. The behavioral side effects are all things that you can see a person going through, including a lack of physical activity, smoking, alcoholism, drug use, and missed work. None of these things are good, and they can all lead to more serious problems if they continue for a long time. The other side of the infographic is the physical and mental health side effects. This list includes some things that you can see a person going through and some you can't. It also includes some that you may not make the link to mental health at all at first. These include severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, and broken bones. All these side effects are super serious and can lead to bigger, more serious things later down the road if they aren't treated right.
Here are some steps that educators should take when noticing signs and symptoms of mental health issues. Step 1. Educators should recognize what is going on with their students' mental health and reach out to them to see if they are willing to talk about it or if they want resources for them to get help from professionals. Step 2. Educators should then set aside a time for a private conversation to talk to the students and help them through it or refer them to the resources that they may need, such as school counselors or other outside resources. Step 3. Educators should continue to check up on them and make sure they are in a better mental state. If they aren't in a better mental state, they should continue to keep checking up on them and try to talk to them about it to the best of their ability.
So here are a few scenarios to think about. These are things that might happen in your future classroom as a teacher that you might need to take care of. So you notice bruises multiple times on one of your students. What actions would you take to figure out the situation? Take a few minutes to think about this and come up with an answer on your own. Something else that you might have to handle in your future classroom is noticing a student is constantly missing school for being sick without showing any signs or symptoms. What do you think the appropriate form of action would be? Take a few minutes to think of an answer on your own.
What are some of the resources available to you? There are plenty of different resources available to the students going to BGSU. There are a few available on campus and some outside of campus. They are all there to help you get through whatever mental health issues you might be having. The BGSU Counseling Center provides counseling to students and staff of BGSU. They're usually open from 8 a.m. to 5 p.m. Monday through Friday, but due to the current events, they only have virtual and phone counseling. The BGSU Psychological Service Centers provide psychological help and therapy, but you do have to apply beforehand to become a client. The Suicide Hotline is open and ready for calls at all times and should be used when needed. It's a very good resource. The Harbor Behavioral Connections Counseling Center has 20 locations throughout Ohio that can help you with all your mental health needs.
There are many different trauma-informed training programs that educators use to help students through their trauma. These include Risking Connection. It is a staff training that teaches a relational framework and skills for working with survivors of traumatic experiences. Next, we have Sanctuary Model and SELF, which stands for Safety, Emotional Management, Loss, and Future. This is an organizational model with training to shift organizational culture and promote recovery. We then have Trauma Center at Justice Resource Institute. This website provides training programs for mental health professionals. Lastly, we have Futures Without Violence, Measuring Trauma-Informed Practice, Tools for Organizations. This provides training on validated tools for measuring organizational trauma-informed care. If you would like more information on any of these training programs, we have provided links to each one of the websites.